get on into it.
Perfect. So kind of want to touch base real quick on basically like what a hospital indemnity plan is. Very quickly, it's going to help cover, I said the kind of the most basic way I can explain it is it'll help cover what Medicare Advantage plans leave behind. So like your different kind of co-pays for any kind of hospital stays you might have or observation care, different things like that. And typically they're going to be specifically designed to match up with Medicare Advantage plans.
Yes.
So GTL's plan in the past has done a really good job of looking at what kind of the average MA plan looks like and having specific days for that. And with this new plan now, it's much more customizable that we'll get into here in a minute. But on the base level, it's basically designed to cover you for the stuff that Medicare Advantage leaves behind.
Yes.
Those different out-of-pocket costs there.
Yes, absolutely. And we want to keep that portion short, just because if you need more information on what hospital indemnity is, you can go to our SMSU or call in, we can have that conversation. But we specifically want to talk about this GTL plan. So Clayton, tell us a few reasons why we specifically love GTL.
So first and foremost, they have been leading this kind of market for quite a while now. The GTL HIP plan has been around since 2008. When I say they're leading the market, they've been the most competitive, and what a lot of other carriers base their hospital indemnity plans on is what GTL does. A lot of the plans look like a mirror image of GTL's plan, and they were the first to do it. They're the best to do it. Typically, why we like them the most is the GI. They have a guaranteed issue for clients who are 64.5 to 65.5, where a lot of carriers won't necessarily have that guaranteed issue part of it. And this is where we see a lot of the production from a GTL product. A lot of our agents write this on that first appointment when they're turning 65 if they're choosing to go with Medicare Advantage. You get in there, that's the only time you can guarantee the health of someone and kind of take that off of the application process. So then you're just looking down at premiums and different things like that, which GTL is most competitive option. So typically it's going to be a good fit for them. Another reason is they're guaranteed renewable. So as long as you're paying your premiums on time, this plan, no matter how many times you use it, will keep renewing. I think it's after 60 days, but they'll keep giving you that plan again. Certain things have different lifetime amounts that they'll allow you to do, but those kind of nitty-gritty details that we can get into here. Lastly, kind of the main point I'd make for why writing GTL over another carrier would be how simple they are for underwriting. So if they're over the 64.5, 65.5, and say you're wanting to get into hospital indemnity to rewrite some of your clients, your current book of business on a hospital indemnity plan, GTL has very few underwriting questions. There's going to be 5 unless you're going into different riders and stuff like that. But just for the hospital indemnity, there's only 5 questions, and they have a 3-month look back for any kind of hospital stays. So basically, if you haven't been in the hospital for the last 3 months and you're fairly healthy, you're going to fly through those 5 underwriting questions super easy. Now, a lot of other carriers will look at 12 to 24 months look back for those hospital stays, and some of them have different questions about how many times or anything like that. But GTL's is so simple, everything's pretty straightforward. And even when you get in the underwriters or the different writers on here, there's not very many questions that are added. And it's all case by case, and that's something they select themselves. So
yeah, and even like their contracting is super easy. They make it super simple. It's one contract, and I think you are contracted with all of their products, which is nice and something that's really popular with one reason why people love GTL products like in general. And they're just a steady, stable, experienced company, and that has been stable for a while. You know what to expect, and normally they're as we will see, like their benefits typically really only seem to increase. They really only seem to get better as time goes on rather than not. And that's one reason, I mean, the Elite plan is literally a testimony to that.
Yeah, they don't typically walk back any benefits that they have. This plan will kind of show the improvements, and I'll kind of highlight some of what it was previously just to see what it used to look like versus now, since it was already one of the best plans and now it's even better. And like Sadie was saying with all the, Sadie was saying, why is that so hard to say? With all their different products being built in, GTL is kind of ancillary focused. They have a med sup in a few states, but their primary focus is the different complementary products. Hospital indemnity, cancer, home health care, final expense, all built into their same contract.
Mhm.
So it really gives you a lot of bang for your buck for the contract. And the hospital indemnity this time of year and throughout the year, this is kind of their bread and butter.
For sure. All right.
So we got the availability map here for you. GTL is very widely available. There's a few states that don't allow hospital indemnity plans, or it's just not available in. We kind of got the list down there at the bottom of where it's not available. And the new product is in 24 new states. So anywhere where the GTL hospital indemnity plan was available, it's still going to be there, but not everyone's getting the new elite plan. So you'll see the kind of nicely color coordinated map. But I'll be happy to look at the availability with you if you're in multiple states and you're just looking to grab your own. Because Sadie and I was discussing that states are hard. Without the little abbreviations, I can't remember all the shapes, but I can tell you where Missouri is every single time. So I'll be happy to dive into that availability with you. We can go into what products are available where, but that's not a problem at all. We can definitely look into that.
Mm-hmm. Also, I forgot to mention, this is a side note. Please feel free to use that Q&A box. If you have a question throughout the webinar, go ahead and ask us. We'll try to get to and answer it, but we also have a Q&A portion at the very end. Normally, that's part of my spiel at the beginning, and I just forgot. It's one thing I forgot, yeah. So anyway.
Yeah, so quite a bit of availability here. And they're going to leave the plan where they're not adding this new one. So nothing's going away. They're just adding this new plan to a handful of states here.
Mm-hmm. All right.
So want to dive into kind of the base plan and how these benefits work. So right now, what they've done with their plan is they've actually lowered the premiums, which is kind of what I want to kick off this with, is the base plan, even where they're increasing kind of the benefits, the price is decreased by up to 14%. And they've also gotten rid of their $20 application fee, and it's kind of built into your quote. And we'll show you an example of a quote here a little bit later. But they've built that in there, and that's just something that some agents kind of come across, and it's kind of a frustrating thing versus a real problem. But GTL heard that, took it, and ran with it and put it right into their quote. So that was very nice. But one of the main changes they did here with the base plan option is they added more options. So this is even more customizable, where it used to be you could pick between 1 or 3 through 10 days and then 15. Now they've increased it where you can do, let's see, it was, yeah, here we go. I got the list. Sorry. It's literally every single day except day 2. And then from 10, it skips to 15. So they gave you quite a bit more room and flexibility, because a lot of these MA plans now with all the different local carriers and everything like that, there's just so many variants that can go into that.
Right.
Plus, you're not necessarily forced to pick what matches your MA plan. So say your MA plan says, hey, we'll pay up on day 3 and then we'll take over. Like you pay up to day 3, then we take over. But you say, hey, you know what? Like if I go to the hospital, I want to make sure I'm covered for a week. Then that money's paid directly to you. So it's not going to be anything you have to turn in to GTL. And they're like, well, you were only there for 7 days and your MA plan covers 3, so we don't want to have to pay that out. It's like, nope, that's what this is for. They'll pay out that money directly to you. And then a really nice addition to their different benefits, kind of things that are included in this base plan, is the hospital benefits. It kicks in after 6 hours, and that's no longer where it used to be 12 hours, and where most carriers are around that 12-hour mark. And then some carriers only would do if you were admitted to the hospital afterwards. GTL is if you're there 6 hours and just observation care, and then they send you out, that counts as that 1 day of being in there. So very nice little extra benefit they added in here. And a few other kind of key points here we'll touch on is the emergency room benefits. With that, it's basically they'll pay you $150 for going to the emergency room. Very standard plan, a thing where ER is going to cost you a lot of money just to go to that. They have an added benefit that if you have to go for that for any kind of accident, something like that, they'll be able to give you that $150 on there.
For sure. And then they have some other kind of cool benefits on there as well that are included in just that base plan. There's that mental health benefit. Basically what this is if you are confined to a hospital and for a mental or like a nervous disorder, they're going to pay $175 per day and up to a week, up to 7 days. So that's something that's kind of a cool added benefit. Now, you have to keep in mind with that that's not something that's in addition to the hospital confinement. It's kind of included. It's instead of the hospital confinement. But it's still a really cool thing. If you're confined for mental health issues, it's going to be covered by the hospital indemnity plan, which I think is really cool. Especially after kind of coming out of COVID-19, and we see a lot of some more of that developing stuff in our senior demographic. But also they have that Ask Mayo Clinic online. Really, I guess that should be kind of in quotes. That's like the title of this cool benefit. If you worked with GTL before, I know they had it on their Advantage Plus, but it's this really cool feature where they kind of have this partnership with Mayo Clinic, and this tool, this feature allows you to, I think you take an assessment, kind of list out your symptoms, something that you're experiencing, and then through that assessment with your symptoms, they can offer you some guidance on care, what next steps you should take, if you should go see a doctor or something like that. And it's available 24/7. So it's just nice and something that will give you good, honest, professional feedback that isn't like Google searching and falling down that rabbit hole whenever you're not feeling super well. So, and it's free, it's included in the benefits. So yeah, that's a cool little thing that they have on there.
Yeah, and something I kind of sped past a little bit here is when you're looking at picking the different days that are available, you can select up to a certain benefit amount. The 1 day benefit, since it's only 1 day, they have a high amount that you're allowed to put on that benefit amount. But for the other selections, 3 through 10 or 15, you can do up to $750 per day. So that really adds up pretty quickly if you're doing $750. But you can select all the way down. I think the lowest is $200 if I remember correctly. But you can select a very low amount, so it can help kind of adjust the premiums. And that's something that's really nice with this, is if a client gives you a dollar amount that says, hey, this sounds great, but like I can't spend more than like $30, $40 on this a month. You can work with their budget, start playing around with the different days, the different amounts, and really try to help get them extra coverage that would fits their budget. So
yeah, that's a great point. Awesome. Okay, so that's our base plan. Like we said, we're going to try to move this through here for you guys. Let's move on to our riders.
Yeah, so as you see here, lots of different riders they have available. This is, again, how GTL does their customization, where they give you this base plan, and then you can look at how many different riders do I want to do. Yeah. One that I always recommend is going to be that second one there, the ambulance benefit rider. It was a very popular option before. They've lowered the premium a little bit on that option, but I believe, for $200 coverage for an ambulance ride, so you take an ambulance ride, they pay you $200. I believe it's like $4 or $5 a month. Wow, yeah. I've got an example of a quote here, but if you're an elderly person who might need to actually use that ambulance and doesn't have the ability to have somebody just instantly drive you over there, then this is going to be a really nice benefit to be able to add for a very small amount.
Yes, and you kind of hear like jokes about how Americans just kind of like, we were talking about earlier, take an Uber to call a friend, something like that. We kind of have this joke because it costs so much, and sometimes people really don't even, that's real, and they don't get the care that they need. They don't want to go to the hospital. They don't want to pay for an ambulance, and this gives them the freedom. This gives them the peace of mind that they can get that care. They can get that ambulance just by adding that rider for just dollars.
Yeah. And a really cool benefit of this, it can go up to $400 and it counts for ground or air.
Yeah.
So if you're in a rural area where an ambulance is going to take an hour to get to you plus go back, then you have the ability, for an air flight. So that's definitely something that to keep in mind, that those benefits can go very high. The kind of top one on here, which is one of the newer ones that they've kind of upgraded, is the skilled nursing facility rider. So basically they've left the amount of day options, but they've added more flexibility for different copays. So basically they have two different options. One's kind of geared more to med sup clients, which hospital indemnity isn't necessarily the best fit for them all the time, but some kind of local hospitals might do more coding for observation care, and they might max out that amount that they're allowed to do for observation care before kicking you out. So you might have been in the hospital for a while, but they just keep you in observation. It's just kind of how it's coded. So if you run into that and it's kind of a consistent issue, then one of these hospital indemnity plans might be a good fit, and selecting certain riders to help out with that can really specify it for more of a med sup client. But the option one is for more med sup. So that's going to be days 1 through 50 of being in a skilled nursing facility. And it pays out $100 to $220 per day. Now, option 2 is going to be more for the Medicare Advantage clients, but that's going to be days 21 through 100. They also will pay $100 to $220 a day. This really allows that to look at the Medicare Advantage plan, see what kind of copays that they're looking for or looking at with that Medicare Advantage plan, and then match it right up with it, just right across the board. I mean, these brochures and the different kits that the Medicare Advantage plans have, you can just literally grab the numbers and then go right over to the GTL app and select which ones you want. The last one I'll kind of go into a lot of detail on, or more detail on, would be the new outpatient therapy, because this one's brand new to the Elite plan. This wasn't on the old plan at all, but they'll pay a benefit of $50 per day, and you can choose between physical, occupational, or speech therapy. So very nice, where it gives you a lot of different options to cover something that normally isn't covered. This kind of is that extra benefit where you guys can really help your clients out with so many different things now as far as the occupational therapy goes. Could be something where they're retired, but they're still wanting to get around. They still want to do their thing.
Right.
They don't want to be slowed down by some kind of injury. So these kind of outpatient therapies are great. This will pay either 15 or 30 days per calendar year. There's a couple different plan options there. And it's also covered for chiropractors. So this is really cool. It's at $50 a day, and you can use this up to 5 days per year. Now, 5 days per year for a chiropractor might not sound like a lot, but if someone's been going to the chiropractor for years and then this is a new thing for them, they might be on some kind of maintenance plan where this is just going to give them additional coverage throughout the year. I go just about every month, but I think after this month, I start going every couple months, but it's just adjustments for your back. So like they'll play around with that amount there, but it can give them some extra money in their pocket for that as well. A lot of these other plans on here, I'll kind of quickly list off. The cancer lump sum coverage hasn't really changed much. They have some different coverage options, but it's going to be kind of your basic cancer plan. Outpatient surgical, critical accident, lump sum hospital, which we decided was hospital indemnity. So it seems like they'll just give you more money on there. And then a dental and vision rider as well. Really just a good way to keep pairing more and more coverage for your clients. If they're like, well, you know, I need a little bit more dental or a little bit more vision with this MA plan, look at that rider, see how much more coverage you can get them pretty easily there.
Yeah, for sure, without them having to, especially with like benefits like that really being amped up in those Medicare Advantage plans now. Sometimes you might have a client that really cares about their dental or really cares about their vision, and they don't want to take out a whole separate standalone plan. Just throw on a rider. That's what, that's why hospital indemnity products are also so great, just for being able to customize, and GTL has so many awesome options here.
A ton of different options. I'd be happy to go into more detail if you have a specific one you're curious about in the follow-up call. Anybody on the outreach team will be able to do that with you as well. But we'll definitely jump into those a little bit more detail with you. Kind of wanted to highlight the new ones or ones that have been changed some. This plan has been around for quite a while. The different riders that we see the most are that ambulance benefit rider, and then I see some of the skilled nursing. Basically gives you a lot of different options with just a couple different riders. So really like those ones.
Alrighty.
So wanted to kind of show you guys kind of how to write this plan. Or if you've been writing hospital indemnity in the past and now this new product's available in your area, how your clients can get onto this new plan. So GTL has made it super easy. They're sending out an addendum rider. They'll automatically upgrade the existing policyholders onto the new plan. So what this means is you get to do nothing and your clients will move to that new plan. Very nice. And you'll get that added benefit of if their premiums got lowered, up to 14%, then they're getting a rate discount as well. So you might have some very happy clients that are like, wait, my plan changed and I got to pay less. How does this work? But so definitely kind of want to touch base on that, because that's kind of a concern of ours, was like, okay, how do you make this switch? Do you have to get them to sign something? Nope, automatically changed in there. But very, very easy to write their e-application. Basically, pop over to GTL. That's going to be this first page you see here on the bottom left. Basically, you click on quote and submit, and I'll pull you over to the main quote page, typing in some kind of quickly personal details, name, date, everything like that. nothing too crazy. But then this application process makes it so nice and easy, where instead of having to do a math equation on the paper app of looking at, okay, I want this many days at this benefit amount, then you have to do some algebra real quick to get your benefit amount. This here, you can live update kind of different riders or different benefit amounts. So I kind of wanted to give you guys a quick, this is kind of a base level coverage, nothing too fancy, but this is going to get them hospital indemnity coverage and get them an ambulance rider on here. So I ran a quote for myself as a 60-year-old male, and I put 5 days coverage with a $300 benefit amount and a $200 ambulance rider. As you can see, that ambulance rider was only $1.43 per month. Crazy awesome benefit, just to kind of, let's just go ahead and make sure that's not a problem ever. And then the benefit amounts, I just pick kind of the average that we see, but with the benefit amount being $300, that's really on the kind of lower end. But as you see, my premium was only $24. Kind of the sweet spot that our agent resources team sees is about $50 in premium, but anywhere from 25 to 75 is going to get them covered for quite a bit there.
Yeah, honestly.
I think that's all I got on that.
Awesome.
They do have the paper app available. I mentioned the kind of math equation on there because since there is so many different riders and different customization, the rates don't necessarily easily match up because they're not going to have one for every single possibility. You basically are just plugging in your amounts and being able to do the math to get the price. This just makes it so easy where if you're playing around with the app, you can change how many days, or if I said, hey, I got $30, we can see how close to $30 we can get. The only kind of heads up my support team gave me was when you're playing around with this, if you're changing quite a bit on there, and for some reason it's just not looking right or something's messed up, start over, re-put those new things in there, because it should live update, but sometimes it'll kind of glitch the system if you're changing every single rider and kind of tweaking it around. Once you kind of found, okay, this is about what we want, you might have to start again. That's just kind of the one heads up that they gave me on that.
Yeah. Alrighty. Well, like we said, we wanted to try to keep this as short as possible. So now let's go ahead and roll into questions. If you have any questions, we'll be here for just a few more minutes and then get you guys back to the rest of your day. If you have any questions, please put them in that questionnaire box. Let's see, we do have one question. Cynthia's asking, is there a waiting period on the dental and vision rider? And I believe, yes, there is. Let me look and see. I have a note here. It says the dental vision benefit rider has a 3-month waiting period. So that's what we have here in the brochure. It's printed off here.
Which isn't bad for just additional dental coverage.
Yeah.
Where the standalone plan, a lot of times the preventative care, it's day 1 coverage, but on the major services, you're looking at 6 months or a year.
Yeah.
So for an additional rider, that's pretty nice.
Yeah, for sure. Absolutely. Like we said, we're here for just a few more minutes if you have any questions. And let's see, did we forget anything?
So I see something about the addendum rider going out. I believe those have already gone out for the areas that it's effective in. I'll double check on that one there for you, Dean. But I believe what's happening is these plans became effective. Some areas it was 8/1, some were 9/1, with a few still trickling in. I think Texas is the last one to come in here. But it's probably going to go by those effective dates. We'll check on that and I'll definitely let you know.
Sure. I think, Clayton, this is probably just from the outside looking in at your guys' team. This seems to be like one of the most exciting new products, exciting new thing to come out, not product, but, exciting plans to come out in a while. And I see your team and Matt Carson and everyone kind of buzzing about it. So it's pretty excited to be able to get on here and tell everyone about it. And of course, we have that video that's coming out soon.
Yep.
But yeah, have you guys been getting a lot of calls on it, or is it just now starting to ramp up? It did come out. It was effective, not effective. Look at me trying to use outreach terms, but September 1st, right?
Yeah.
Whenever people could start rating it.
Yeah, so a lot of excitement around this because this was already one of our most recommended hospital indemnity plans. Basically, I always like to suggest that you have a couple different options. So you give your clients that this or that versus the yes or no, but their this or that is typically going to be GTL or GTL.
Yeah.
So definitely something that we're very excited about. And these benefits just got better. The premiums got lower. They didn't walk anything back by making those premiums more affordable.
Yeah.
So the way they're doing this is they're just plugging away at this where people need the additional coverage, but not everyone's using it. So their loss ratios are great over there. But what they're doing is making sure that clients have coverage so they're covered for any kind of major out of pocket. You know, a lot of these MA plans have that $0 premium. So the clients that gravitate to that maybe can't afford the price of a med sup, or they're willing to take the risk. Now, those clients that aren't able to afford a med sup really aren't going to be able to afford that, you know, few $1,000 hospital stay if that comes. Right. So this is where that really kicks in, where explaining how this can help cover them additionally for a low cost versus having to pay a huge out-of-pocket thing when it hits.
For sure.
Kind of take some of that stress off of, okay, you got a Medicare Advantage plan. Yes, this is $0 premium, but as we all know, nothing's technically free in life. There's always going to be something out there that could bite you, and it's that hospital stays with the Medicare Advantage plans.
Right.
So if you're staying, let's look at one of these hospital indemnity plans. This is one that I really feel is a must. At least bring it up to all of the clients that you're talking to Medicare Advantage this year. It's on the scope of appointment, correct?
Yes.
Okay, I had to double check this myself the other day. But on the scope of appointment, so you can talk about it then. I would highly recommend, if they don't check that box or you don't get a chance to talk about it this AEP, make it the first thing you do in Q1. Like, hey, how's this Medicare Advantage plan working? Did you get your cards? Is everything coming along so far? Okay, great. Now, we mentioned the kind of out-of-pocket cost. GTL hospital indemnity.
Yep. Right there. Alrighty, well, it doesn't look like we have any more questions, so we want to thank you guys again for kind of halting your afternoon to come and hang out with us and check out this GTL Hospital Indemnity Elite plan. If you have more questions, we'll have that follow-up email, we'll have that follow-up call, and we want to continue the conversation and get you all set up with this and get you excited about it. So again, thank you so much. Do you have anything else to add, Clayton?
I don't think so.
Awesome. Okay, well, best of luck in AEP. We're rooting for you all. We're here for you all. Please give us any question and any calls, emails, whatever you need. We want to help you and help you be successful. So with that said, get back to your day and yeah, best of luck in AEP.
Thank you guys.
Thank you.